Good afternoon. Thank you for joining us today for our COVID-19 media briefing. It was a year ago this week, San Diego County had its first COVID-19 case. And this anniversary reminds us how long and difficult a year it has been. We, of course, recognize both the loss of life from the pandemic, more than 3,400 San Diegans who lost their life to COVID-19, and we recognize the loss of a way of life for so many. Our small businesses, our in-classroom learning, families, schools, and so much more. And I think as we look back over the preceding year, despite all of the difficulties and challenges and adversity that we faced, San Diegans can be proud of the way we've responded. We've saved lives, we kept our hospital systems intact and from being overloaded. And where we stand right now, a year later, is making substantive progress in climbing out of the COVID-19 pandemic. We are now at a point a year later where our daily actions are all designed to help us recover and help us move out. We're very mindful that we have to continue to monitor the spread of the virus. We're very mindful that we have to continue to utilize face coverings and avoid high-risk settings. We're very mindful of the possibility for additional strains. But we come before you today with a series of things that all represent progress and steps forward as we come out. Starting with our progress in achieving the red tier. This has been a lot of hard work of San Diegans in lowering the case count, a lot of hard work in getting vaccines into arms, but all of these have combined and come together to put us on the cusp of being able to achieve this next tier, which will be some relief for our gyms, our restaurants, and a series of other entities, but also represent another step in our progress. Our case count this week was about 8, and while that is above the number that is traditionally needed to descend into the red tier, there are 2 paths for us to achieve the red tier this time next week, which we think is highly likely. One is if the state hits the measure of 2 million vaccines in a certain HPI quartile of zip code, then that case count changes to 10. And we do expect that next week we will be under 10 as we are this week, which means as early as next Wednesday we are likely to descend into that red tier. The second one, even if the state doesn't hit that, we have another path to get there with the percentage of positive and health equity indexes, but we feel confident the state will get to that 2 million vaccines in the hardest hit zip codes, which will change the case rate for red and go to 10. We have 1 week now in the bank in red. We expect that we will be under 10 next week, which means there's a high probability and likelihood that next Wednesday we will descend into that tier. We obviously have to wait and see what our numbers are next Tuesday, but we feel confident that that will happen. Another positive step forward was the United States Congress taking action a few weeks ago to pass a $1.9 trillion COVID relief bill. This is going to help as folks get back to work, providing help to families who are in need, to our small businesses, to so many. We estimate at the County of San Diego it could be around $600 million that would come in that we could obviously use for the public health related expenses. We've incurred tremendous costs around vaccinations, continued costs around testing, and all of the efforts around public health response. But then we can also use some of those funds. The board will consider and decide how to use the balance of those funds, but to try and meet the need or fill in any gaps between state funding, federal funding, and where there still are needs. And so as we move forward, we will be assessing, the Board of Supervisors will, in terms of the prioritization of funding the public health related expenses to COVID, and then looking at how we can most effectively use what is left to try and help our region as we recover. We also saw good news with the CDC guidance this week for individuals that have been fully vaccinated, and this is also encouraging. There's certainly a lot of learning left to be done about the vaccine and the virus and what's happening, but based on CDC guidance, which the County of San Diego embraces, individuals can gather indoors, fully vaccinated individuals can gather indoors without wearing a mask, and you can, if you are fully vaccinated, gather indoors with unvaccinated people from one other household, as long as no one has an increased risk from COVID-19. So again, this is a continued progress for those who have been fully vaccinated to get a little bit more flexibility in daily life. We still want folks to avoid large crowds. Let's still ensure we're physically distancing for non-household members, and all of the normal type things we do. But we do think, again, this is progress. If you remember in the early days, or not early days, throughout the duration of last year, there was great concern around the availability of enough hospital beds. And we as a county, in partnership with the state and federal and with our healthcare system partners, expended considerable energy trying to increase the availability of beds. One component of that was the federal medical station, also referred to as the alternate care site that was stood up at Palomar. That was increased capacity and increased staffing that was available to be there. We are now in a position to have a kind of warm shutdown of that facility. The equipment and beds will remain in storage in San Diego County. The staff will be dispersed to other sites in the event they are needed, but there had been 0 COVID patients there, and so we're able to kind of wind down or stand down that capacity, which again is another positive step forward. Vaccines continue. The shortage of vaccines continues to be a challenge and a source of great frustration. We are encouraged. We continue to do significant numbers of vaccines and remain at the very top of the state of California in numbers done. Now almost 25% of San Diegans have received at least 1 dose and 1 shot. But there are shortages, and the bulk of what is being honored right now are second dose appointments. We honor those first, and then with what's left, we make first dose appointments available. Again, we've always thought the first half of March would be when we would see increased supplies. We're really hoping in the coming week that the numbers of vaccines that arrive into our county increase so we can reach more folks. We did receive about 14,000 doses of the J&J vaccine. Those were initially prioritized for those hardest to reach, our farm workers, our unsheltered, seniors, and other locations like that. I visited the convention center with Mayor Gloria to help administer that to some of those individuals. And then with what is left, they will go into the general circulation and supply for vaccines. So we will keep you posted on that. Speaking of the convention center, as the sheltering operation there for the homeless begins to wind down and those individuals are transitioned out of there, we are preparing to stand up an additional superstation location in the convention center. It will be pending the arrival of a significant increase in vaccines. So we don't know exactly when that will be, but we are making arrangements and preparations to be able to administer those. We do think at some point here, it's got to happen soon, hopefully, the supply of vaccines will increase significantly, and we will be in a position of maximizing all of our capacity at our close to 30 sites throughout San Diego County. On the subject of vaccines, on Monday is the greatly anticipated expansion of vaccine eligibility. These are for individuals with underlying health conditions. Now, again, it is going to be subject, the appointments will be subject to the availability of the vaccine. So it could be very limited appointments available until we see an increased supply. But on Monday, March 15th, we will open up eligibility for those 16 to 64 years old with specific health conditions. Includes cancer, chronic kidney disease, chronic pulmonary disease, sickle cell, obesity, Down syndrome. There's a listing on our website of the conditions that are eligible and apply. And within the next 24 to 48 hours, we will also publish on the county website the documentation that someone will need to make, will need to have if they show up for an appointment with one of these conditions. We're going to try and make it as easy and seamless as possible. We know our healthcare system partners know these individuals who have these conditions, and they are likely to increase their efforts in proactively reaching out to folks if they have vaccine available. Again, if they have vaccine available, but our public sites will also be available to these individuals with pre-existing conditions as well. So in the next day or two, look for guidance on how that process will work, and we will roll that out next week. So again, a series of things that I think all represent progress in our continued climb out of COVID-19. Again, being very mindful that the virus remains here, and we want to continue to be cautious so that we continue on a positive trajectory with things representing forward momentum. With that, let's jump into our charts real quick. First, you will see here, again, total doses administered. We crossed the 1 million mark. We're at 1,128,915 administered. You see almost 14,000 there, pending documentation to be entered, and a fairly significant number of those that are scheduled coming up. But you can see almost 25% have received 1 dose. 13.7% of San Diegans are fully vaccinated. Now that we go into J&J, obviously those individuals, when they get the J&J shot, will only appear in that bottom number there, fully vaccinated. And again, we're appreciative of the arrival of that vaccine as it helps us adding to the array of vaccines that are here. We just hope we get more of them and quick. Case rates, again, remain very, very stable. Very low numbers you'll see here on the next chart. Our percentage of positive continues generally trending down. That is encouraging. Our daily numbers in the 300 to 400s, a day with 100. Again, the testing numbers are down. This is not due to a lack of availability of testing. Any San Diegan who wants a test, we continue to have a robust network of testing sites available. There is just less demand from the public for tests, but we will continue to make them available. But generally encouraging numbers on case counts. And then finally, the state monitoring metrics. You'll see right there we're at 8.8 is our adjusted case rate, almost the same as the unadjusted case rate. The two boxes there, the 3.3 testing positivity percentage and health equity, both of those were in orange. And so even if we don't hit the trigger for higher case rates, if those don't change, we would have the ability to descend into the red tier next week. And I just want to point out that our case rate at 8.8, 8.9, it was almost at 100 when we started this year. That is the progress that we have made as a case rate that was almost at 100 has come down to 8.9, which is a great credit to a lot of the work that everyone out there is doing. So good progress. We are working our way out of this and are encouraged to continue our forward momentum. We'll hear next from Supervisor Vargas, and then we will go to the questions.
It's on here. Thank you, Chair Fletcher. Last week I was thrilled to hear that the governor addressed inequities in our healthcare system, and I think all of you know that we've been working hard at the county to ensure that we have different programs and interventions that are going to be making a difference. When the governor announced last week that 40% of COVID vaccine doses were going to be allocated to the hardest hit communities, we were able to identify about 12 zip codes, and on those we already have 5 pods that are directly in those zip codes. What's important to note is that we have been looking at the zip codes. We know that there are nearby locations where many of these folks can go and be able to have access. But we're going to continue to look at the most impacted areas that were not included in this list to ensure that we are advocating for additional distribution of vaccines and ensure that our community members that have been the hardest have access. As I mentioned, some of the interventions and the programs in place in some of the hardest hit communities, including highlighting the Promotora program, our 211 expansion, the pilot walk-up sites, the no appointment South Bay Superstation at the Border View, YMCA, and Otay Mesa. I'm really proud to announce that these programs have been successful and they are working. Of course, we need more vaccines. We're working on that, but more importantly, I wanted to make sure that I share with you that the infrastructure that we're building and the programs that we're creating as interventions are working as we're trying to address the issues of health equity in our communities. Just an example of this is with the pilot program that was in place, targeted in the county of South County, resulted in about 17,000 people being vaccinated from February 27th until March 8th. This week, and in partnership with the Otay Mesa Chamber of Commerce, we also had a UCSD mobile vaccination unit that has been vaccinating food-related employees in the Otay Mesa community. We have also been very committed to education and reaching to our communities in partnership with our different organizations on the ground to provide correct vaccine information, as well as encouraging folks to get the vaccine when it's their turn so we can safely go back to the things we love. As part of this education component, I want to share with you this particular 2 quick public service announcements that will be running on TV in the coming weeks. One of them is in English, and we'll do the English one first, and then we'll do the Spanish. Oh, the other way, okay.
Cuando sea su turno, vacúnese contra el COVID-19 para protegerse a usted y a su familia. Conozca más detalles en coronavirus-sd.com/vacuna. Regresemos a pasar tiempo con nuestros seres queridos.
When it's your turn, get a free vaccine to protect you and your family from COVID-19. Let's get back to the things we love.
Learn the facts at coronavirus-sd.com/vaccine.
These PSAs are extremely important. As we've mentioned before, this is a community partnership that we must have to ensure that our communities have access. We have about 1,469 radio spots in English and Spanish in 9 stations. And then the TV ad campaign starts next week, but with about 522 spots on 11 TV stations. El mensaje de hoy es muy importante, como vieron el documento hoy, a compartir en español, es que el próximo 15 de marzo, el nuevo grupo para elegible de la vacuna serán aquellas personas que incluyen las personas de 16 años o más que tienen enfermedades graves como cáncer, enfermedades renal crónica, etapa 4 o superior, enfermedad pulmonar crónica y el dependiente del oxígeno, afecciones cardíacas, entre otras. En 24 horas más o menos vamos a poder darles a ustedes una lista en donde pueden encontrar los documentos para no solamente qué ocupan para comprobar para poder tener acceso a la vacuna, pero también para poder hacer su cita. Para ver una lista completa de las condiciones de salud, para ver si usted es elegible, puede visitar www.coronavirus-sd.com/vacuna. Muchísimas gracias.
Thank you. We will now go to our questions. Our phone system we had some problems with today, so they're all going to be texting questions today. We will get that resolved and fixed before next week. And Dr. Wooten is not here today. We'll be back, but Dr. McDonald is on hand for any medical-related questions. So let's go to our first texting question.
Okay, this question is from Kelly Beal from Fox 5. We've heard concerns from people who are unable to find an appointment to book their second shot. From a medical standpoint, how is too long to wait? And what advice do you have for those who can't seem to get an appointment?
Yeah, I'll have Dr. McDonald address that.
Thank you for that question. You know, the ideal time to get the shot series, either the Pfizer or Moderna vaccines, is with no earlier than 4 days before the time that's recommended, which is either 3 weeks to a month out, up to 6 weeks after the first shot. So that's 42 days after your first shot. That's the ideal time to do it. We do know that there are some issues with some folks having to delay past 42 days. That is okay. You should still try to get the shot as early as you can. And you don't need to repeat a first dose. That's again, a very common question. There is actually some ongoing work to look at whether even delayed second shots might be more efficacious than the current schedule, but we are trying very hard to stick with the currently recommended schedule. So try to go on the date that you're due. If it's delayed up to 42 days after your first shot, you can do that with very good comfort. And if you need to go beyond that, again, try hard to get the vaccine. Your provider knows that your shot has been delayed, so they should be connecting with you to prioritize you compared to other individuals.
One quick thing. Thank you, Dr. McDonald. Also, I just want to share the site that's had the most challenges with second doses, our Petco site. We have been informed they believe they've secured enough Moderna to honor and schedule all the second dose appointments. So hopefully this will get resolved, but we know it's been frustrating.
This question is from Jonathan Rosen at the UT. San Diego County still hasn't signed a contract with Blue Shield, even though the county said last month that Blue Shield understood our existing vaccine system and would not affect things much. Can you please explain specifically why San Diego hasn't yet joined this effort, whether we plan to, and whether not partnering with Blue Shield or a delay in doing so could affect our vaccine allocations?
We're working with Blue Shield. We're in ongoing discussions. We have some questions, and there are active talks that are underway. But we don't think any delay in getting there is going to impact our ability to get vaccines. And we're confident that we will be able to continue to both receive vaccines and administer them very, very quickly. So there's ongoing discussions around the structure, what it would look like, how it would work, and those are underway and will continue.
This question is from Eric from Fox 5. Can you please break down how many vaccinations each super site is giving out each day? I know Petco's goal was 5,000. How many have actually been going out?
I don't have the numbers of each site each day. It varies day by day depending upon availability and supply of vaccines. We know Petco and some of the others can do up to 5,000 per day, but again, it really is dependent upon the supply. And so we have a significant amount of underutilized capacity, meaning we could do a lot more vaccines than we're doing. We just don't have enough. And so as the allocations come in, we do our best to distribute them to each site. Some of them have had to pause or slow down. Many of them daily fluctuate in what they do each day based on the supply of vaccines. So it's a very fluid and dynamic situation. We are very hopeful. I've seen the president say multiple times that by May, every adult who wants a vaccine will have access to it. That's great. We're in March, so we need that to start trickling down here to the county so we can start getting them in arms. But we are hopeful that the supply will increase and every superstation will be operating at maximum capacity every single day. But again, that's dependent upon the availability of vaccines.
This next question is for Dr. McDonald. What feedback have you provided during the health officer calls with the state about the expansion of the red tier case rate?
I'm sorry, I didn't hear the first part of that question. Could you repeat that?
What feedback have you provided during the health officer calls with the state about the expansion of the red tier case rate?
I am actually sort of standing here in Dr. Wooten's stead. She's our health officer, and she's been the one that's been involved with those kinds of conversations. So we'll have to get back to you to get that specific feedback that we've been giving to the state, unless other folks want to comment, but I don't have the answer to that for you.
All right, next question.
Okay, this next question is from Priya at NBC7. The next tier opens up vaccines to anyone 16 to 64 with comorbidities. Under HIPAA, that information is confidential. The people at the vaccine clinics will not be able to ask for proof of any ailment. How will this stop people without comorbidities from getting the vaccines? How will people who are underserved not be forced to wait even longer by people lying about their health?
Yeah, within the next 24 to 48 hours, we'll be sharing on our website the documentation an individual will need to bring with them if they come to one of the public sites to get a vaccine. It's obviously not a HIPAA violation if they bring their own documentation of their condition and choose to share that. This is a challenging situation, though, because you want to create a system that verifies the individuals actually have this while understanding and recognizing that not everyone has access to the healthcare system in the same way, and not everyone is necessarily going to have the same medical documentation if they haven't been connected to the system. And so we are going to work to try and design a system that is equitable and fair. And in some part, we're going to be dependent upon people to be honest, to not lie or attest or fake documentations to get a vaccine. We do think that the healthcare systems and our clinics and a lot of those folks obviously know who has underlying health conditions and knows how to reach them, and so they will be doing a lot of them. But we want to make sure this option is available via the public network we've built out to try and provide access to folks who may not be a part of the regular healthcare system. So there will be some documentation or some attestation component of this for individuals to verify their underlying health condition. And again, it's a very challenging situation of providing access to it without an overly burdensome verification process that would not allow the quick facilitation of administering vaccines. So we're going to work through it, and we should have more details about how this will work on our county website in the next 24 to 48 hours.
This question is from Claudia Lucio. She says she would request her answers in Spanish, please. Can you share what type of documents will 16 and over with chronic diseases need so they can start preparing for their appointments?
Thank you, Claudia. Muchísimas gracias por la pregunta. Pues en realidad, como sabemos, el 15 de marzo vamos a abrirla para una nueva fase de personas, ¿verdad? Sabemos que para muchas personas que no tienen acceso a médicos va a ser un poco difícil. Entonces, por el momento, lo que estamos haciendo es creando una lista para que las personas puedan saber en realidad qué documentos van a poder traer para confirmar que sí tienen alguna de esas enfermedades. Entonces, en las siguientes 24 horas Vamos a tener una lista en inglés y en español. Yo me comprometo a asegurarme que esa información esté en todos los medios de habla hispana y que la gente tenga acceso a esos documentos. Pero por el momento, si tienen información de su médico, de su clínica de salud, esos son los documentos que pueden llevar. Si no tienen un médico que pueda responder porque tengan alguna enfermedad, porque no tienen un médico de alguna manera, vamos a ver cómo podemos ayudarles porque sabemos que es importante que tengan acceso a la vacuna.
The second question is, vaccine supply continues to be a problem, forcing some sites to shut down or close early. What is the county doing to gain access to more vaccines so we don't fall behind once more people are eligible?
Sí, es una pregunta muy importante, ¿no? Que específicamente de qué vamos a hacer nosotros con las vacunas y cómo vamos a tener más vacunas en el condado. Estamos abogando para que existan más vacunas, como sabemos que el presidente Biden ha dicho que todas las personas van a tener vacunas antes de que empiece el verano. Así que lo que estamos haciendo nosotros es asegurarnos que exista la infraestructura para poder recibir esas vacunas en cuanto lleguen. Tenemos ahora ya 3 vacunas, Pfizer, Moderna y JJ, ¿verdad? Que son las 3 vacunas que están accesibles a las comunidades. Entonces, entre más rápido lleguen las vacunas, más pronto las vamos a poder distribuir. Creamos una infraestructura específicamente en las áreas en donde sabemos que ocupamos más acceso para las comunidades y que existe equidad. Entonces, en cuanto lleguen esas vacunas, las vamos a distribuir. Por el momento, pues hemos tenido un grave problema con eso, pero como vieron hace poquito, empezamos ya los medios de comunicación a trabajar para que la gente tenga la información que necesitan e informarlos que pueden hacer su cita para la vacuna. Gracias.
This question is from Matt Hoffman. Can you provide more details about the new media outreach and why you believe it's necessary?
Yeah, the media outreach, and we can get you copies of the ads that are out there and they're running, combination of media efforts. And we know that in certain communities there is going to be a little hesitancy, and it's hard to really see or identify that hesitancy right now because there's such limited supply and such crushing demand. But we know at a certain point that dynamic is going to change. And so we want to reach communities with trusted messengers, with messages that we believe will work and will resonate to try and build that confidence so that we are investing in preparing for the day when we have more vaccines available than we have demand. So this has been an ongoing effort to design this program, prepare this program, launch this program, and we think it is appropriate to launch now, even though we don't have significant availability, just knowing it'll take a little bit of time for this to work through.
This is a follow-up question from Jonathan Rosen at the UT. Can Supervisor Fletcher point to a few specific issues the county is trying to resolve with Blue Shield? Is the problem my turn? Is the problem patient health information? Why are we still having discussions at this stage?
Well, I'm not going to point to specific things. It is an ongoing discussion about what an arrangement would look like and how it would all work. And you know, every other county is going through similar evolutions and similar discussions. You know, we want to ensure that there's a full understanding of exactly how the system will work. We're working very collaboratively to ask questions and provide information, and I think that this will get resolved. None of the nature of the ongoing discussions is impacting our ability to receive vaccines, and it's not impacting our ability to administer vaccines. And so we will continue working through these issues to ensure we arrive at a point that best serves the people of San Diego County. All right, that concludes our briefing for today. Thank you all for joining us. We'll be back with you next week, and we'll have our phone line resolved next week. Thank you.